Hello, everybody. I want to talk about the CRNA school interview today. I get so many questions about it. I also have a couple other videos here on this YouTube channel that you can check out. I also have my interview bundle, which has everything in it that you could possibly need to prep for your interview. And that also is in my roadmap program for aspiring CRNAs. You get the interview bundle in that. So just want to throw that out there. I have resources everywhere. But what I wanted to do in this video is because I have the interview bundle. I work with, I have done so many mock interviews over the years. I've been doing them for about 4 or 5 years now. So I've done a ton. Yeah, 5 years now, actually, which is crazy. So I want to just share some gems and some things that I tell people in my mock interviews and just kind of further help you guys prep and get ready for your CRNA school interview. Okay. So your interview is where you win your seat in the program, right? And instead of letting that like freak, oh my God, I have to be perfect. I have to be, no, none of that, right? Imperfect people get into CRNA school. No perfect person gets in there. There is no such thing as a perfect interview. It's just not possible, right? We are humans, okay? We are not robots. We are not machines. We have AI now and all this stuff like that, but we are still humans, okay? So imperfect people get into CRNA school all the time with imperfect interviews, all right? So get that through your brain. And if you have been asked to sit for an interview, they want to get to know you. They're intrigued by your package. They want to get to know you better. They want to see who you are. They want to see how you handle pressure. Do you think critically? Are you emotionally intelligent? Do you have skills of a leader as a budding emerging leader, right? Can you communicate well in high pressure situations? And basically, are you the type of person that they think will excel and do well in their program? Okay. So just remember the interview is about you. It's about being yourself. It's about being you and sharing your journey. And I just did a post actually in my interview bundle now about kind of answering questions what if my GPA was low and they bring this up, or this happened, or I had a gap in employment because I got sick or whatever. Guys, that's life. It doesn't really matter what has happened. It's what have you done about it? What are you doing about it? And how are you going to integrate that into their program, right? It's about who you are and who you are becoming and showing them that you understand that this is going to be hard. And here's how I've prepped. Here is how life has prepped me to be in CRNA school. It has all led me to this moment. Okay. That's the focus. Okay. Other thing I want to talk about quickly is I'm going to talk about in this particular video, I'm going to talk about the 4 types of questions you may see commonly in interviews and just give you some kind of tips and tricks on how to answer them. And hopefully that'll help you prep for them as well. All the interviews are different. Okay. There's a lot of schools, new schools are popping up all over the place, which is super exciting for our profession because there's still a lot of people to take care of and there's a lot of room and a lot of seats at the table. So come get yours, come eat at the table. Okay. You're welcome. You're welcome at the table. But all the interviews will be different. Sometimes there's now a Kira assessment interview that you have to record and do there. I mean, it could be a 15-minute interview. There could be stations. It could be a big panel. Zoom. There's so many types. So I want you to not really focus on what's going to happen, right? Because you don't know. You don't know. Don't focus all your time on what is out of your control. What is in your control is prepping, is knowing the school well, knowing that school inside and out, knowing their faculty, knowing the history of the school, knowing the program directors, the clinical sites, like know the school, know why you're a good fit for that school, why you like that school, right? Like your research, right? That's what's important, controlling what you can control. So I don't want you to get worried in the nitty gritty. We don't even know what questions they're going to ask you. They could ask you 5 questions. They could ask you 15 questions. They could ask you 2. You know what I mean? But it doesn't matter, right? It doesn't matter because we don't know what they're going to ask you. But what we can do is we can prep. We can know potentially some of the things they might ask, and we can get very clear in who we are, who we have become over the years, and how that all relates into the person that you are going to be and that they want and need in their program. Okay. So let's just quickly talk about the 4 types of questions you may see. I will give you some advice on them as well. And again, it could be a mix of all these questions. It could be just getting to know you, EI. It could just be clinical. We don't know, right? That is out of our control, but we are going to prep because your preparation will never be wasted. Okay. So one type of question that you might see in your CRNA school interview is behavioral questions. Okay. And that's essentially like how do you behave? How have you behaved in the past in certain situations? How might you behave in the future? Because here's the thing, your past behavior may also predict your future behavior, AKA how you handle things, right? Or what you learned from something so that you can do better later. That's life. That's the point of everything. Because again, we are all imperfect and we are all still figuring it out. We're not arriving anywhere. We're just continually figuring things out. Okay. So some of the things they might ask you, like, how did you deal with like a conflict at work? Or how do you deal when someone isn't pulling their weight? Or tell me about a situation where you had to like advocate for a patient, it was uncomfortable, or you had to speak up or something like that. Like, how have you behaved? Or if you're in the OR, they might give you scenarios in the OR. A surgeon is yelling at you, a preceptor is doing this, like, right? So they want to see how you handle yourself. And what I teach in my interview bundle is STARS. So STARS is STAR. It's actually called STAR. I added an S on it, but you can Google this and look this up anywhere. But essentially, kind of the format for answering questions is the situation. So what is the situation? What happened? Give them context. We don't need to talk for an hour, but a quick context of the situation. Action, the task behind it, or the action, right? What task did you do? What action did you take, right? What did you do in the situation? And then what was the result? Okay. And then the S that I added to it is as an SRNA, right? So now we have the situation, the task, the action I took, the result. How is that going to relate to you being an SRNA? How can you bridge that gap? And I'm going to have a second video called Bridging the Gap in your CRNA School interview that I teach in my mocks all the time. I'm going to teach it to y'all too. Okay. But that is the method for kind of thinking through and answering these questions. Lay the context. What action did you take specifically? What was the result of that? And how are you going to use that in CRNA school, right? So we're focusing on growth in these questions. We're focusing on accountability. We're focusing on responsibility, your self-awareness, all the good things, all your leadership stuff. Okay. Okay. Second type of question they could ask. And again, there's like some overlap with these things as well, but this is kind of a way to clean them up in your brain a little bit, is the what if, or again, situational. So this is kind of eliciting, how would you behave, when this, like, how would you behave when a certain thing has happened or someone does something, or either hypotheticals or real life. And these are more situational what if. So what would you do if your preceptor asked you to give something you weren't comfortable with giving? Or what would you do if you didn't know an answer to a question? How would you handle that? How would you respond to a patient maybe deteriorating on your unit or something like that? So situational things, what if? A lot of times they want to see your clinical judgment. They want to see how you think under pressure. They want to see like that critical thinking piece, that what are you going to do like in the moment? Popped in. But I was talking about, they're looking for like that critical thinking piece. Okay. So what you want to think about in any type of situational things is always like staying calm, right? Staying calm, being in charge of yourself and that self-awareness and your response, right? Always prioritizing safety. It always comes back to the ABCs, right? And walking them through your process. So what would you do if? What is your specific process? I say all the time in my mock interviews, specific. It doesn't mean talk for longer, right? But just be specific and be clear. Don't be like super vague. Okay. Be very specific, as this is what I would do. This is what I've had. This is what I have done. You want to be rich in examples, rich in specificity. Okay. And if you have to ask maybe a clarifying questions or something like that, you have a question for them, or you want them to, you're basically kind of thinking out loud. You're showing them how you think, how you kind of process through situations. Okay. Okay. The third one is those emotional intelligence questions, right? And I always say, get very clear on your values as a leader. We do a lot of work in that in both coaching programs as nurses and with my SRNAs, is being very clear about vision, values as a leader. Okay. But emotional intelligence questions a lot of times they're looking for emotional intelligence things, right? Self-awareness is huge. Your resilience, your ability to bounce back. And again, how are you going to handle being a novice again and learning and things like that? Okay. So you want to be very honest with these questions, reflective. And this is why a lot of the interview prep is just getting very clear on your journey and who you are and how you become. Look back to look forward. I've done these things, so I'm going to be able to do these in CRNA school, right? It's prepping for the interview is very reflective. Okay. But talking about how you handle feedback, telling them about mistakes you've made and how you've responded to that. Okay. And sometimes even like in them getting to know you, how you are handling talking about yourself, right? And communicating with them. They're watching all those things like that. Um, one of my big things that I also coach on and talk about a lot is being vulnerable about your growth can be very powerful. You don't have to get into the weeds and be super personal or none of that, but just showing them that you are a human and showing them like owning your mistakes, owning things. This is what I did do, right? And now I'm moving into doing this and there of how I have improved, right? Specificity. I cannot say that enough. Be specific and be very clear when answering any kinds of these questions. Okay? So that's about these three. And then we have clinical questions. I feel like these are like love or hate. So people are like, oh my God. So number one, you know a lot. A lot of people can use the CCRN. They'll use their CCRN study materials to study for that. What I also say in my coaching program is think of like 1 to 3 patient situations, like a sick, challenging patient you've had that had a lot of comorbidities and either like neuro or a surgical patient or trauma, whatever it may be, 1 to 3 of them, and study through your patient, their diagnosis, their comorbidities, the medications you give, why you were giving those things, the procedures they had. Were you managing their sedation? How did you notice it? Like study through scenarios, like really pick them apart. We do that a lot in my program as well. It's like, okay, this is a scenario. Let's study off of that. Okay. So a little trick for clinical questions. I also have tons of information in my interview bundle, which you can also use it for CRNA School. It's like foundational stuff is in there that will like help you in CRNA School. For those of you that I got now I want to study stuff, I'm like, just look at your interview bundle. There's enough in there, and also enjoy your life a little bit. Okay, but anyways, clinical questions. So they could just be straight up like, what is minute ventilation? How do you treat metabolic acidosis or alkalosis? It could just be straight up like question, branches of the aorta, walk me through blood in the heart, like anything, right? 1,000,001 things they could ask clinically. ACLS, rhythms, knowing that. Walk me through a sick patient you take care of, like, or a hypotensive patient, or someone who's struggling on the vent, or what do you do with a patient with this diagnosis, right? I mean, there's a lot of things they can ask. And again, don't let that freak you out. Just know your craft. You know what you know, and you know more than you do. And if you don't know something, just, man, that's a great question. I'm gonna have to look that up. Like, thank you for showing me a gap in my knowledge. I'm gonna go look that up, right? Like, again, imperfect people get into school. You're not gonna have a perfect interview. You're not gonna know everything. I sure as heck don't know everything, right? But you will know enough. And again, they want to see you. How do you navigate? How do you handle yourself when you're under pressure and when you don't know something? It's far more important to be able to handle yourself than it is to be perfect. Okay? Because you're not gonna be perfect. Let that go. Okay. So they're just looking to see if you have baseline clinical knowledge. And again, how do you think through scenarios, right? So you're always going to be thinking systems. You're going to be thinking your head to toe. Like I said before, always go back to your ABCs. It's never going to steer you wrong. What do you do as a nurse? Like they want to see how you think and how you nurse in your unit, right? How do you lead in your unit? Okay. So don't panic about these. It's great. It's a great way to test your knowledge and a great way to flex the muscle of like fire rapid questions under fire. Because guess what? The interview is the interview, but when you get to CRNA school, you're gonna have preceptors asking you questions. Like, you know what I'm saying? Like, this is everything is prep for what's ahead. So don't let it scare you. Lean into it and let this process refine you. Okay. So last little pieces of advice, practice, definitely practice out loud. You do not have to do a mock with me. There's other people that do mocks. You can do a mock with your dad, your grandma, your friend, somebody else, like whatever. I have a lot of people that just put their video on or put your Zoom on or put a video on and record yourself answering questions. And I always say in all my mocks, I record my mocks and I give them a copy. I always say, like, watch this back, like as if you're a top tier athlete, like the Kobe's, Michael Jordan, right? Like as you are a top athlete, Tiger Woods, you watch your game back, not to shame yourself, but to see how you can improve. Okay, I love what I did there. Didn't like this so much. Let me tweak that. That's what leaders do, right? That's what top tier athletes do. They watch themselves back to improve, not to shame. Okay. So you can, but definitely practice out loud. I cannot say this enough. Do not memorize. Do not freaking memorize whole scripts. That goes into that trying to be perfect. It just doesn't breed well. It doesn't look good in the interview. Okay. There is a such thing as being like too prepped and too perfect. We don't want that, right? Once you walk into that room, trust the process, trust your preparation, and focus on being present in the moment, because nobody can do that interview but you. Nobody can get into that interview and be you and do as good of a job as you can. Like, they want you to be in that interview. So show up as you. Take a deep breath, have fun, breathe, relax, and show them who you are and show them that you are ready for their program. Okay. Your goal is not to be perfect. I'm going to say that a million times, write it down, but to be authentic, to be prepared, and to be confident in who you are and what you do know. Okay. Remember, robots and perfection doesn't make it into school. It doesn't happen. Okay. All right. Trying to think. I'm looking back at my notes to see. I think that was all I had. Yes. Okay, perfect. So put a lot of little stuff in there for you to think about and to work on. If you haven't checked out my other video, it's called Bridging the Gap. It's another thing I always coach on in my mock interviews. We go deeper on that concept in my interview bundle. I will post the links to everything below. Happy interview prepping. Congratulations if you got a CRNA interview. And if you have not got an interview yet, keep prepping, keep working, keep moving forward. You freaking got this. Okay. All right. Toodles.